Alright, y'all, yins, I don't know, whatever other kind of grouping words, use folks. In this video, we are going to see how the sympathetic response and parasympathetic response, how they manifest themselves here. So this fight and flight response, what's the ultimate effect on our body? The blood vessels, the pupils, and heart rate, respiratory rate, all that stuff. So we're gonna look at both the sympathetic response and the parasympathetic response in this video. And a good rule of thumb here. As we learned with the dual innervation, whatever, if the parasympathetic nerve sending more than the sympathetic nerve to the heart, there's going to be a parasympathetic response and vice versa. But a good rule of thumb is when parasympathetic activity increases, sympathetic activity decreases, and vice versa. When sympathetic activity increases, parasympathetic activity decreases. So they are inversely related, and that's really due to that dual innervation, essentially. So first off, what is the effect on heart rate going to be with a sympathetic response? So hopefully you're thinking, okay, it's going to increase it, and the reason is, feel free to actually pause the video after I ask each of these questions, because obviously whenever you can think of something and have that aha moment, it's really gonna stick between the ears much better there. So obviously heart rate is going to increase because whenever you're fighting or flighting, you need more oxygen, need more nutrients, so you could produce ATP. You need energy for ATP, so you could beat the hell out of the bear or run like hell from the bear. Pretty much there. So heart rate's going to increase, sympathetic response. Respiratory rate also going to increase because you need more oxygen. Once again, respiratory rate, breathing more oxygen in. Oxygen ultimately going to help us produce ATP to help us use energy to either beat the hell out of the bear or run like hell from the bear. Or maybe a little bit of both. Beat the hell out of the bear, beat the shit out of the bear, and then run like hell from it while it's on the ground. That's either way. Either way, though, we need more oxygen. The respiratory rate increases so we can produce that ATP. So what happens is when there's a sympathetic response to the diameter of the bronchi, so the tubes in the lungs, the bronchi, you got it. There's going to be a dilation because we need more air in. It's easier for air to flow in, which allows more oxygen, which ultimately allows more oxygen to run through our blood, which allows more ATP to be produced for that fight or flight response. So the diameter of pupils in a sympathetic response, yes, you got it. They're going to dilate because whenever you're in front of that bear, when your pupils dilate, you could see more of your surroundings. So you could see more out of this compared to out of this. So when you're like this, it's going to help with that fight or flight response, that awareness. Pupils are going to dilate so you could see more. Duh. What's going to happen to digestive functioning? You got it. It's actually going to decrease, and that is because we only have so much energy in our body, so we want to focus that energy whenever we're fighting or flighting, not to digest the baked potato we had earlier this morning, but to really send that energy to other processes to allow us to run or to fight or anything like that. So this digestive functioning also ties into saliva production. So saliva production will decrease as well because our energy when we're fighting or flighting are for focusing on other different processes. Diameter of the blood vessels in the skin, what's going to happen? Dilate or constrict. You got it. Diameter of the blood vessels in the skin are going to constrict because we don't really need the blood, the oxygen on the outside of the skin or towards the outside of our bodies whenever we're fighting or flighting. We want that blood, that oxygen to really go to the heart, the lungs, and the skeletal muscles, the important areas that are needed for that fight or flight response. So if you think a lot of these reasonings through, they do make quite a bit of sense. So what's going to happen to the diameter of the blood vessels in the heart and the lungs in a sympathetic response? You got it. They're going to dilate. So we need more blood, more oxygen, so we can ultimately react optimally to whether we're fighting or flighting to this stressor. The adrenal medulla secretion will increase. So there's going to be epinephrine and norepinephrine secreted, which are hormones. In this case, they take a little bit longer to kick in since they are hormones, but once they're called sympathomimetic. The epinephrine and norepinephrine are called sympathomimetic, which means they mimic the sympathetic nervous system. So the epinephrine and norepinephrine, they do mimic the nervous system's response. So obviously they're going to increase the heart rate, increase the respiratory rate, so on and so forth. Last but certainly not least, sympathetic response. What will it do to, what will happen to urine production? Not your production, but urine production, urination, urine production. I'm not yearning for you, that like urine, the fluids in our body, urine production. What's going to happen to urine production? Come on, I don't got up there. Let's go. Yeah, okay, you got it. I'll quit jabbing at you. Urine production is going to decrease, and that's because urine production decreases. We want to maintain our fluid balance in our body, which maintains our blood pressure. We can't have our blood pressure lowering to the ground, or lowering to, a really poor low level if we're trying to fight this bear or run from it. So urine production does decrease to maintain fluid balance, to ultimately maintain blood pressure. So that's the sympathetic response. Now we're going to go through all these with the parasympathetic response and see how they differ. They're usually pretty much always going to be opposite of the sympathetic response. So for instance, heart rate, what's going to happen in the parasympathetic response when the parasympathetic nervous system's activated? You got it, heart rate's going to decrease. Respiratory rate decreases. Diameter of the bronchi, the tubes of the lung, you got it, they're going to constrict. We're in that rest and digest rest and digest response. Diameter of the pupils, obviously we don't need to see as much when we're just resting and digesting, so pupils are going to constrict. Digestive functioning with a parasympathetic response is going to increase, so rest and digest. Digestive function is going to increase. Also, saliva will increase. Diameter of the blood vessels in the skin, very good. No effect. Remember, the exceptions of the dual innervation are blood vessels, adrenal medulla, and then the sweat glands. So the parasympathetic response, there's going to be no effect on the blood vessels, diameter of the blood vessels, because parasympathetic, there's no nerves that there's no sort of innervation in the heart that affect the blood vessels in general. Obviously, what's going to happen to the diameter of blood vessels to the heart and lungs with the parasympathetic response? You got it. Once again, no effect for the same reasons, because parasympathetic activity is not... there's no innervation of the heart of a parasympathetic nerve. Just sympathetic for blood vessels, adrenal medulla, and the sweat glands. And some other ones too, which we haven't discussed. And then the adrenal medulla secretion will happen in a parasympathetic response. Once again, no effect. Very, very good job. And that's due to those exceptions we just mentioned and mentioned in a previous video. And then urine production, not urine, like urination production. I'm not yearning for my true love. The urine production with the parasympathetic response is going to, you got it, it's going to increase. So sympathetic response, urine production decreases because you need to maintain that fluid balance. On the other hand, parasympathetic response, urine production is going to increase. So yeah, they're pretty much opposites, parasympathetic response and sympathetic responses, but just rule of thumb, when parasympathetic activity increases, sympathetic activity decreases, and when sympathetic activity increases, parasympathetic activity decreases. That's why when somebody urinates themselves when they're scared, you may think it will increase urine production, the sympathetic response, but that actually just whenever someone gets scared and lets go of urine, that is due to just whatever buildup was in the bladder already. They aren't producing that urine and then leaking it out real quick. Whatever in that bladder, oh my goodness, a bear. it might be released essentially there, and that's due to the increase of the sympathetic activity and also the decrease of the parasympathetic activity. But yeah, just a nice rule of thumb: when one goes up, the other goes down. When one goes down, the other goes up, and so on and so forth. And just think of that kind of urine example there. When somebody gets scared, they may urinate themselves. That's not due to the increase of urine production. It's due to the decrease, actually, of the parasympathetic activity of just, letting everything loose real quick. But that's the parasympathetic and sympathetic responses. Talked about dual innervation in the last video. Talked about all this good stuff in this video. We'll see you back here soon. Do you promise? Okay. All right, I promise to.